I want to thank the Minister for his response. Minister, I recently met with Professor John Crown and we had a good discussion on cancer care. And one of the issues that he raised with me was, again, those high-tech drugs that you talk about in the field of cancer. And he was very enthusiastic and very supportive and excited about a lot of those new drugs. But he also pointed out that many of them are not available to patients in this state because, as he put it, and as many people who work in this area put it, the slowness of the drug approval process, unfortunately, in this state. I want to also raise with you, Minister, the drug patisiran, which is a life-saving treatment for hereditary ATTR. And that's a disease, as you know, Minister, that is peculiar to people in this island or on this island. Again, it's available in the north. It's not available to patients in the south. I think that's problematic. And my point that I'm making, Minister, is that we can all celebrate these drugs when they come on stream. There's huge advances being made all of the time, but if patients can't access those drugs quickly and timely, then we have a difficulty. And I genuinely believe it's an area that we can make improvements in, and I certainly want to work constructively with the Minister, as does the Health Committee, to make advances in this area. Thank you.
Thanks, Deputy. Minister.
Thank you, Deputy. And there have been several conversations and representations made about exactly the second drug you've referenced, patisiran, and I will revert to the Deputy and indeed to colleagues with an update on that particular drug. I think any opportunity we can find to accelerate access to these new and exciting drugs should be taken. And I think at the same time, I've had a conversation with medical oncologists, actually, I believe just this week, on access to new cancer drugs. So of the 50 million that's been allocated for new drugs, there's no set amount yet. The budget doesn't get sliced up per care pathway, but it would be quite reasonable to think that 15 million of the 50 million, or maybe up to a third of the 50 million, will actually end up for some of the really exciting new drugs. I asked the medical oncologist as well, though, is there an opportunity for us to save money within the existing amount? Remember, we spend €2 billion a year on drugs. Their very clear view was that there is, in terms of biosimilars and prescribing practices. What I would love to do is protect the drugs budget and indeed add the 50 million to it, find ways of reducing the costs within that 2 billion and reinvesting that saved money back into further drugs again. And that certainly seemed to be something they were up to discuss further, and I'd be delighted to continue the discussion with yourself and with the Health Committee on that.